everyone. We are here tonight with you. Week 4, Ellen, is it week 4 of COVID-19?
I think it is.
Shelters?
Yeah.
I think it's about week 4. And we are joining you every Wednesday at 6 p.m. Pacific Standard Time. For some of you, that's 8 or 9. Thank you for being with us tonight. We are here. My name is Kristen Hassan. Ellen?
Hi, I'm Ellen Jefferson. I'm the Executive Director of Austin Pets Alive and American Pets Alive.
And I am the Director of Pima Animal Care Center in Tucson, Arizona, and I'm also on the board of the National Animal Control Association. And we're here tonight to talk to you kind of about some updates, but also to talk about engaging your community, because the way we talked to our community 4 weeks ago is not the way we need to be talking to them now. So we're going to talk all about what that looks like and how to change the way we're communicating and the things we're saying to our community in order to get through this time. The main goal for both of us is to prevent mass euthanasia of healthy, perfectly great animals who are going to die in shelters if we don't act quickly. And that's because this is a disruption to our system like none we've ever seen. So we are here, part of talking to you about engaging your community. The key to the equation is the community. So that's going to be our focus tonight. So, Ellen, what happened since last week? What has occurred? I've heard food shortage worries. I've heard every single animal from some shelters has gone into foster care. What else is going on this week?
Oh my gosh, it feels like it is growing daily, the list of things that are changing, and it's a little daunting. But yeah, I think that some of the main topics that we've been talking about are around a possible food shortage, and it appears that the manufacturers are in a good place for food production and continuing to keep shelves stocked. But I think that knowing that we don't know exactly when this whole COVID crisis is going to end, and what that might do to our economy and everything that affects animal welfare, I think it's something that we should be keeping in the back of our minds as we're moving forward. And I know you've been instituting some programming around saving food and trying to get it to the people that need it the most.
Yeah, we've been lucky. We've gotten a number of donations from Greater Good, Chewy, and PetSmart, and we're really stockpiling everything now because we live in a community with a high rate of poverty and a lot of folks who struggle to feed their animals on a good day. Before this all happened, we were doing 4 homeless outreach events a week, and we were supplying food to all those pet owners and really serving hundreds and hundreds of people. And we're in a position now that we're trying to conserve food for the pets in the shelter, but also give pet food to the community. So that one of the things we did this week is we made up a sheet of human foods that animals can eat if people do have a problem getting food. And there's so many things that dogs and cats can eat that we don't even think about giving them. But up until I don't know when like pellets of dog food became the norm, but up until then that was all dogs ate and cats. So
yeah, super interesting. And then I know we've also been talking about the second dog testing positive in Hong Kong, and all the shutdowns. Like Texas is just on a wave of shutdowns, city shutdowns, and what that's doing to everybody's operations as far as changing the way they operate with adoptions and fosters and drive-throughs and spay and neuter services, which is kind of a big topic because in Texas, at least, it's the law in the Texas Health and Safety Code. There's a provision that any releasing agency has to release animals to the public spayed and neutered or sterilized already. So
that's true for Arizona too.
Yeah, so this is super problematic if we can't do spays and neuters in the foreseeable future because we can't have crowds of people around and we're not staffed to be able to take animals in all day long from foster. Like over the course of the day, we're staffed to do kind of high volume, high quality spay neuter. So it's lots of things are in the air that I know we and everybody else probably on this call are trying to work through.
So if you have a state law like that, which we do you just send all the animals to foster until we can resolve this? Because I mean, at this point, that's what we're going to be doing just because we don't have time to navigate the state laws. Or are some people trying to get state laws suspended for this time?
Well, I think it's maybe a combination of both. We're actively working with our state legislators to try to get a suspension of that health and safety code provision during the crisis. And I think that with the governor's the order to stop all non-essential surgeries in the healthcare profession, that makes it an open door to talk to them about trying to suspend that, so lots of animals won't be killed in shelters because they can't get spayed and neutered. And so we've got some friendly people at the state that are helping us. And I think in the short term, working on pre-adopt status or sending them home as foster to adopt, or adopt them out and just make a note that it's during this crisis. I really don't think that state governments are going to be penalizing shelters for doing the best they can, given all the criteria, all the things that are making it super hard.
Yeah, I know, we put out NACA, the National Animal Control Association, put out a statement. It's almost been 2 weeks now, saying that if you can't sterilize the animals for whatever reason, whether you're trying to preserve supplies or your vets are out, that should not mean that you hold them in the shelter or that you euthanize them. And when we first put it out, we got a lot of pushback from people saying, I think it kind of blew people's minds because spay and neuter has been our #1 priority in many cases for so long. And then the Association of Shelter Veterinarians, the shelter medicine schools, and now the ASPCA have all followed with the same guidance. How do we start explaining this to our communities? Because I feel like there's going to be a lot of confusion with people saying, like, you're sending me home with a pet that isn't spayed or neutered. Like, I don't even know if they'll understand. How do you think we should be talking to our communities about that?
Well, we're navigating that problem right now. And I think what we're landing on is trying to communicate that if it's an emergency, we will do it. So if the animal's in heat or they're at risk of losing their home because it's a cat that's spraying, that we'll get the surgery done, and we'll just work it into a normal day, but not a mass spay neuter day. The other thing we're trying to do is spay and neuter animals before they leave, if we can keep the number of people down that are handling those animals. So it's all new territory, and we're trying to move everything to foster as fast as possible, and we've already got a ton in foster, so we're sort of behind the 8 ball. There's no way we could have predicted where we would be right now and also prepare for that in terms of spay neuter. So I think it's a matter of just trying to do the best we can and communicate to people that we're here for them, and if they're having a big problem, we want to be able to fix it.
Yeah, it's like, do you think there's like a middle ground? Because that was when we thought about suspending all spay neuter surgeries, we were thinking about like so many situations where that might prevent the pet from staying in a home, like a cat that's spraying or heat. So do you think there's a middle ground for most organizations where they can sort of make a determination? And if they're making that determination, are there any guidelines about what unaltered pets might be most likely to be problematic in a home, or is it just case by case?
I think it's case by case at this point, because every cat is going to be a problem sometime during the summer. So it's just trying to figure out how to get the workload down to a point where it's not a gathering of people. Because it's really not about, it's not even so much about the PPE, it's about the congregation of people and trying to keep people safe and not have too many people in one space working and
I think the impetus for it though was the sort of who was it that made the ask? It was a federal ask, right? It was like the Federal Health Authority or someone like that said, please don't do, if you're a dentist or a veterinarian, please don't do surgeries that you don't really need to be doing. So I think that was the impetus. And certainly, we know we can reuse PPE, but there's also like the drugs that are used, and trying to just generally be conservative when it comes to medical procedures, but that maybe that doesn't mean that animals get sterilized.
Yeah, I think so. And I shouldn't say it's not at all about PPE. It is. Hospitals, human hospitals are in dire need of as much PPE as they can possibly get. But at least in our shelter, that's not we're not wasting a bunch of PPE on every surgery, you
Right.
know? So it's
Oh
just
yeah, it was the
balance.
Surgeon General, right? It was the Surgeon General who
I
made
think
that
you're
ask.
right.
So, okay, so we have to start explaining this to our community that not every pet may be altered immediately, which might actually honestly be easier to explain to the average adopter and foster than it is to the advocate who's like, you're doing what? A lot of the pushback we got were from folks that, you know, they've done TNR for years. And we were talking, you and I were talking to Dr. Livy on a call earlier this week, who was saying 25 years ago, most pets were leaving unaltered. And do you remember those days? Like, do you remember when that was the norm?
Yeah, I mean, when I first got involved in shelters 20 years ago, it was, we were trying hard to spay and neuter everything. And it was sort of the beginning of the more militant approach to, or maybe it wasn't the beginning, but it was a difficult thing to get all the animals fixed. And it was something that people were pretty militant about. So I don't know exactly when it started, but there's, you know, I know from doing research on the topic that it wasn't until the 40s that it was even mentioned as a possibility to curb population coming into shelters. So certainly it hasn't been around forever. Obviously.
Right, like we're gonna have to get through this crisis and then sort of say, okay, what are the results? And I actually think it could be it could give us more information about the effectiveness of spay neuter to see what are the consequences of this spring for this year, next year, and the following year to see, are we going to really see an impact in population? So it'll tell us a lot.
Yeah.
Okay, so moving on, I keep hearing about shelters closing down, and I don't really understand because every state that I'm seeing is considering animal shelters to be essential services. I don't think there are any that have shut down that haven't. Why the heck are shelters closing their doors at this moment when it seems like what they should be doing is slowing intakes and slowing outcomes to maintain sort of a steady flow in and out? What are they thinking?
Well, I think that maybe it might be our fault as national groups not messaging really well, because we're saying on one hand, if you're a government entity, don't round up the animals that don't need to be rounded up, leave them in the community. And then on the other side of the coin, we're saying if you're a transfer in shelter, don't decrease your transfer in unless you're not needed. And so I think maybe we're doing a little bit of mixed messaging, and we need to get better at differentiating between the two. That it's all about keeping animals in homes somehow. And so if the government-funded shelters are not bringing in the animals that are fine in the community and they're not injured, they're not ill, they're not at risk of being shot by their person or abandoned somewhere terribly, then leave them alone, because they can wait this out wherever they are. But I think when nonprofits or transfer in shelters do the same thing, it's not quite the same effect, because they're shutting the door to shelter animals that are already stuck in shelters somewhere else without the manpower or woman power to do the work to care for them and get them adopted and get them into foster homes because of shutdown. So it's sort of this weird double-edged sword that we're trying to navigate. And I think maybe we need to get better about talking about the difference between the two.
Do you think that the problem is that groups that historically don't face overpopulation, so you get shelters like mine in El Paso and Austin and Houston, they're inundated, right? They're still dealing with these massive populations of pets. And typically what happens is transport partners, receiving partners, whether they're local, like the rescue groups and the private shelters, or they're far distance transport partners, what's happening is that they're not taking in animals. So then it compounds the problem for these municipal shelters. Do you see that happening? And what do you think the message needs to be to the private groups right now who aren't completely inundated?
I do see that happening. And I think that the message, hopefully, you know, I think that we have to focus on keeping people safe. I mean, that is absolute priority, but I think it can be done. We can keep people safe and we can save lives. And so I think the message is that, at least internally for us at Austin Pets Alive, our message is we're needed now more than ever, because there's so many outlets that have been created for sheltered animals to go out into a variety of live outcomes. And right now it's almost, in some communities, it's being restricted just to transfers. And if that's the case, then, and the transfer agencies aren't taking them in, then it's not going to be long before those, even with a staggered intake or slowed intake into a government funded shelter, that they're going to be full and have to face decisions about cage, you know, having too many animals in cages. And then also around staffing. You know, I just got news that a shelter right around the corner from us, or a community right around the corner from us, they laid off their entire animal control force. And so I don't know, you know, I'm worried that because of the economy and government's trying to tighten their belt, what's going to happen if, you know, there's staff shortages, and then being full is all of a sudden over full, and decisions have to be made right away.
Yeah. Well, that gets me to sort of where we're at PAC. And I guess I want to share a little bit about what we have done, because it is not without its challenges, particularly when it comes to talking to the community. So we typically take in this time of year anywhere between 1,500 and 2,000 pets a month. We rely on moving quickly. So our stray hold is 3 days. We are trying to move animals through as fast as we can, but when this happened, it slowed everything down. It slowed adoptions down. And so we worked with Greater Good to do a massive foster plea to the community, and the response was actually overwhelming. And we run the nation's largest municipal shelter pet foster program. So we send out 5,000 or more pets to foster every year, but the response was so overwhelming that we have now 600 to 700 people waiting to foster pets that just haven't come in yet, which is amazing. We're going to need them in the next like 2 weeks. But at the same time we were doing that, what we found is that we were getting crowds of people coming, and it was really hard to help them maintain social distance. People just were not, I think they were thinking about adopting a pet. They weren't really thinking about keeping themselves safe and our staff. And we feel a really, as you, a really strong responsibility to the volunteers and staff. And so we knew after last weekend we had to make some immediate changes because people were just coming and coming and coming, which is incredible. So we shut our gate. We have a gate around the premises. We shut it and we moved to the appointment-based system, which I had really resisted because it seems, I mean, it is a clear barrier to people helping you. It's a physical barrier to people helping, and it slows everything down. But we didn't really feel like we had a choice. And now we're trying to triage everybody before they even enter the premises. And it's hard because what's ending up happening is that because we have a pretty low number of pets, and there's the dogs with medical or behavioral issues and the cats from hoarding cases, not everybody wants one of those. And so we're sending some folks away, and it's just sort of breaking my heart to send anyone away who wants to help right now. How do you, the way we're communicating this is I'm going live on social media every day. I'm sending out emails to the volunteers every day. How do you think shelters that maybe are more strapped for time, how do they navigate this? You ask for help, you get tons of it, but you've got to control how that help comes in.
It is so hard. And, you know, we're struggling with it, honestly. And we're asking people to be patient and flexible, and to help the shelters around us, and also to wait, because we are continuing to transfer in. We are trying to help we're trying to focus our efforts on the shelters that are, that have shut down and the animals are in danger. And we'll have animals for them. But yeah, it's a really tricky message. And I think that reminding people, our foster teams have done a great job kind of continuing to beat the drum of we want you, we're really appreciative that you're here, please be patient, we're trying to connect you with an animal. But it is overwhelming. So so I don't know that I have a good answer. We've been doing quick Facebook Lives. It's faster for me to talk than it is to type. And so that we've started doing Facebook Lives as well, trying to do them daily to just get a message out about what is happening right now on the ground, so people understand that it's not, because we have fewer people on campus also, and so they don't know firsthand. So getting a little glimpse, I think, is important, even if it's not great.
Yeah, I think the Facebook Live videos, people are really scared to do them. I think we've been told in sheltering we shouldn't do them because animals are unpredictable and God knows what'll happen when you put animals on camera. But we've been filming animals live for years, but now we're just filming ourselves live, and the community appreciates it so much. Everywhere I go, someone stops me and is like, I haven't seen your update today. What's happened? And it's just amazing how many people are tuning into those. So that's a really great strategy almost anyone can do, and it takes no money, it takes no time. It's like 2 minutes of your day to get to a ton of people. And combine that with a news release every week, and you're kind of getting to different groups of people. We have a question. So if you're just joining us now, I'm here, I'm Kristen. I am from Pima Animal Care Center and here with Dr. Jefferson from American Pets Alive and Austin Pets Alive. But we're here talking about communicating with your community. If you're just joining us, please feel free to ask questions. We are reading your questions. We're about to answer one, but you can also join us on Mondays. Every Monday we have a call. If you are a professional in the field, whether you're paid or unpaid, if you consider yourself an animal welfare professional, you can join the American Pets Alive Shelter and Rescue Support page. It's a group on Facebook. And every Monday we're having a meeting, and we had 140 people in the meeting last Monday. We're hoping to get even more. The reason those are cool is that it's not like this where it's mostly a one-way communication unless you're typing in. We actually get to hear from shelters all over the country and hear about what they're facing. So please tune in. That's at 7 a.m. Pacific Standard Time, 9 a.m. Central Time. And you can access that by joining that Facebook group. So we'll go to a question now. Someone asked, what does your process look like when a foster parent is asked to meet an adopter in public? We just received stay-at-home orders today, but we're operating with scheduled adoptions outdoors. Well, I think that the first thing is it's important to read your stay-at-home orders carefully. We certainly don't want to encourage people to leave their homes unnecessarily. The shelter is actually, so as an essential service, shelters are still performing adoption and foster placement during stay-at-home orders. And having people come to the shelter where you actually can control the environment very closely, you can have them meet outside in a play yard and you can make sure that's a sanitized space, is probably the safest way to do that if you are on stay-at-home. But in Arizona, we are not on stay-at-home orders yet, but we're actually talking about bringing service to the community. So delivering pets to people's homes, along with delivering foster supplies, because I think the reality is settling in that if we're asking fosters to hold pets for 2 to 3 months, which is more likely than not at this point, we're going to need to bring stuff to them when they can't leave their home. So I think each order sounds a little bit different than others. So you want to read them carefully and make sure you're adhering to them. But if you are an essential service performing those functions, it's fine to have the foster and the adopter meet at your location.
And I would add to that we've started doing the virtual meet and greet. So having people, having our fosters show the animal on Zoom or Google Hangouts to the potential adopter, and then doing the pass off after they've made a decision. And depending on the comfort level of the foster and the adopter, we're experimenting with having like a crate transfer. So having the animal be put in a crate and then the foster walks away at least 6 feet away so that then the adopter can pick it up. And so trying really hard to limit the distance. We are on the shelter in place order right now, or stay at home orders. And it doesn't prevent people from doing basic functions like going to the grocery store or even stopping by work and picking up stuff. It's just preventing any kind of big grouping of people. So it's trying to limit as much unnecessary contact as possible. So we're trying to respect that and come up with these other ways to do it.
Yeah, we're finding that you really have to show people what 6 feet means too. I think it's been one of the lessons of this. We've used so much blue tape. If you don't have rolls of blue tape, order some, because we're taping everything to show people what 6 feet means. And you can see in the grocery stores, this is happening too. And the grocery stores are great ways for you to learn how to manage people coming into the shelter, because they're really getting it and they're keeping people as they're in line 6 feet away. And they're also keeping them 6 feet away from the cashier in many cases. So we can learn some lessons from the way. And I know private vets are having people drive up into spots and then call in. So we can take lessons learned from private industry on that as well. Okay, so what are some, I feel like we've been talking to a lot of shelters who are missing some of the basics. And it's like they're not doing the things that they need to do that seem simple but are getting skipped. And one example is daily staff meetings. Ellen, are you doing like daily team meetings with your team now? Because I feel like there's all this anxiety, there's all this like stress and uncertainty. Do you feel like the daily meetings are important?
Yes, we've been doing daily manager meetings. We're a pretty big organization. I think if you were smaller, you could do all staff meetings, but we've been doing manager meetings every day on the phone, just a quick touch base. Here's the updates for today. Here's the new things happening in the clinic or on dog team or cat team or foster team, and just trying to keep everybody informed so that there's no surprises and we have a chance to talk through things. I mean, the communication right now is so much better than it normally is because we're actually doing this daily quick huddle is what it's called. So I really appreciate it. And then our directors are meeting quickly twice a week as well. So just trying to make sure that we're keeping the communication lines open and foreseeing as many problems as we possibly can across teams, because everybody's scrambling to do the work they need to do, and it's really hard to understand what that ripple effect on the other teams are going to be.
Yeah. What about volunteers? Are you using volunteers at this point? Are they coming in? Are you keeping them home? How are you advising them? What are you guys doing in terms of that?
We are doing a few things. We have some essential volunteers, and they're people that we consider essential to coming in and walking maybe a specific dog or helping with our parvo unit or something like that. And so those people are coming in to do the duties that they would be doing if we were open normally. But it's not just open to any new volunteer or volunteers that don't volunteer on a regular basis. The other thing we're doing is trying to engage volunteers in some of the behind the scenes fundraising things, like we had to close our thrift stores because of the shelter in place order. And so a lot of our volunteers are helping us sell items online, which is awesome because we need the income from our store merchandise. And we also we were really worried about running out of paper towels and the ability to wash hands and then dry hands. And so we've had a lot of people take home towels or bring in towels and cut them into these little 4x4 or 6x6 squares that then people can dry their hands and just throw it away. And that way we're not wasting a giant towel on one person's hands being dried. So we're trying to be as creative as we can to use people's goodwill while they're stuck at home, and of course fostering is the best way.
So okay, I want to talk about fostering because I was talking to I got to meet with my boss today, who's like the smartest person I know, and I think he always gives me such good insight about where we need to head. And I said to him today, we're trying to move all of the pets into foster and keep the shelter basically empty. And because, for a lot of reasons, and he understands all of those. And he's like, yeah, I think eventually you can do both. And my initial reaction to that was like, but it hurt my heart because I don't think we can do both right now. But I struggled to explain that to him, and he gets it. But I struggled to explain to him why I don't think we can do both. And so I'm wondering, if I'm challenged in that way, how are we going to explain to our communities that we really believe it's important that our shelters stay at a very low capacity? We're talking about 50% being minimum. I'm going for closer to 90% of our capacity. We're at, as of today, we have 84% of our animals in foster homes, which is amazing. How do we tell the community why, especially when spring and summer comes and they see a lot of kittens and puppies and they're like, why are you still restricting intake? You have room. How the heck are we going to explain this to people?
I honestly don't think it's going to be that big of a problem to explain it, because I don't think this virus is going anywhere anytime soon. And so we're going to need to prevent crowds in our shelters for a very long time. And we're going to be under the constant threat of staff getting sick and having an entire department be sick and have to be quarantined, which we can't, none of us can operate with an entire team just being MIA for 2 weeks. So I don't see how we can possibly fill our cages back up immediately and expect to be responsible with the care of the animals. So that's what I would say. I think that long term, after this virus does go away, I'm worried about the economy. I'm worried about the stock market and the effect that that's going to have on government budgets and on nonprofit donations. And housing animals on site is so much more expensive than housing animals in a foster home. And so thinking about it from a dollar and cents point of view, I think that it makes a lot of sense to be really transforming the way that we care for animals that need this transition space from homeless to home, and really rethink how we can do it in a more effective, safe under this virus threat, and a cost-effective way.
Yeah, it seems like we were trying to order Excel and trying to order other cleaners and other supplies, and we're not getting very far. I mean, we're already looking at shortages. We wouldn't, if we were at capacity, we wouldn't have enough supplies to care for the pets in the shelter. And so that's one compelling reason. But another one to me is that this is so unpredictable. And we know just from other pandemics, other flus, other terrible viruses that they can change. And that means the situation can change. And if we could all be facing potentially shutting down just because people are truly ordered to stay at home. And I think it's unlikely, but it's possible. And for us, as a municipal shelter, I think the animals are so much safer in homes if that were to happen. If that were to happen, we could be asked to euthanize animals. I think that's the reality. And I'm not sure people are quite getting that this situation can turn on a dime. And so if you can get them all in foster, you've just reduced your risk and liability the lives of those animals. Do you think that's right?
Yes, absolutely. I think that it's sort of like diversifying your cage space. If you diversify, then it's harder to take one piece down and take the whole entity down. So I agree 100%.
So we're going to have to reallocate staff, and some of our staff are going to be out delivering supplies, and they're going to be, we're looking at how to do medical appointments in the field instead of in shelter, and we're sort of exploring all those, but those are the questions shelters need to be asking now, I think, because we're 3 weeks away. We had some foster returns today, and people mean well, but they get that pet home and they're like, I'm stuck at home and there's like this giant galloping animal in my house with me. So that's going to happen too. We're going to start to see some of those pets come back, and thinking about how do we manage. We're looking at our shelter at managing 3,000 pets in foster at a time. That means we just have to reallocate every staff member to getting those pets from foster to adoption, and managing, like, we'll literally have turned our community into an animal shelter.
Yeah.
It's like foster is no longer a program, it is the program.
Mm-hmm. Yeah, love it.
So what are you thinking about when we think about we talked last week about the past, and we can look to other examples in history of when this has happened. And I actually just saw an article from Pima County from the Spanish flu in the early 1900s, and the headline was exactly identical to, I'll pull it up actually, I think I can find it. The headline was exactly identical to the headlines we see today. So history is repeating itself, right? But how do you think that relates to animal sheltering? Like, how is our history repeating itself now? Has anything like this ever happened before to animal sheltering that you know of?
Well, I mean, the whole premise of animal sheltering is around the rabies virus, and it wasn't because people were worried about dogs having rabies. They were worried about, wow, that's crazy.
Sorry, it's backwards. It says, with 27 cases of Spanish influenza in Tucson, all public places are closed. Churches, motion picture houses, public and private schools, and pool rooms are included in order by acting mayor. Same headline. Crazy, right?
That is crazy.
Sorry, I interrupted you. I just think it's so wild.
No, it is insane. And it's so interesting that viruses are the reason that we do any of this with sheltering animals. And so I think that the big epiphany for me has just been around the realization. I guess I didn't quite understand that shelters were built because of rabies and trying to give owners a chance to reclaim them before they were shot. Dogs, because rabies was such a huge problem. And so that's been such an epiphany for me, because the industry didn't pivot the way that you would expect after the vaccine came out. And so, like, for me with this virus, I'm thinking as soon as we get a vaccine, everything's going to change for the way that we work as humans with each other, and the way that we have to house animals or work in groups and all of that. We can go back to being more normal. It's so interesting to me that after the rabies outbreak, we didn't go back to normal. We kept the normal was what communities did to eradicate rabies. And it just kept going. And so it's really fascinating that a virus is what created our whole shelter industry. And then now we have a virus that's sort of pulling it apart and giving us, I actually think we have a huge opportunity. It's giving us the breathing room to look at how we operate and how we use our resources like staff to maybe do it like we would have done a long time ago if rabies had never happened. Like, if rabies had never happened, our communities would have created infrastructure for animals, because animals over time have become more and more a family member. And so we have a chance to do that now, because we can't have shelters the way we've had them for the last 100 years.
Yeah, you and I both, we recently spoke, we did the plenary sessions at the American Pets Live conference, and we both talked about things that turned out to be much more relevant to COVID than we ever imagined they would be. And we're going to be posting those presentations over the next couple of days, but they're both, Ellen's presentation is really about the emergence of the animal welfare movement as we know it today in animal sheltering, all based around this rabies. And mine was about the connection between companion animals, wildlife, farmed animals, and social justice movement. And those two things have become really pressing topics in this moment, because we have this opportunity, I think, you know, in the midst of seeing so many people worry terribly outside of COVID about their jobs and their livelihoods. This is a time of real tragedy for a lot of folks, even if it's just temporary. And so it's a little hard to be hopeful about anything, but if there's anything to be hopeful about, it's that we can take a more collective responsibility for homeless animals. And I think this idea that you find your neighbor's pet, and instead of walking around the neighborhood and trying to get it home and putting up a flyer, you're driving it to an animal shelter, which is far away. It is hard to access. Some people are scared of the institutions of animal sheltering. That idea is not necessary. It's not a way we have to live. It's just a way we do live. And if we start to take a more collective responsibility, and we're doing this now, we're asking people, if you find a stray animal that's not hurt, keep it, hold it, put it on social media, try to get it home yourself. We'll probably find that pets get home more frequently when we do that than when they come to the shelter. But the shelters can't do it all right now. And we need to communicate that really clearly with our community. We have to tell them every single day we can't do it without them, because it's the truth. No matter how much money our particular organization does or doesn't have, we can't do it.
Right. Well, the irony is we've never been able to do it without the community. And so this is just bringing it front and center, that they're a huge piece of the puzzle. But we've never been successful as an industry without the public being involved in a big way. Successful in terms of life.
Somebody on who's watching asked, is paying fosters crazy? So what do you think? Is it crazy?
I don't think it's crazy, but I guess I just don't believe it's necessary yet. You know, I think that as we continue to expand the use of foster homes and the level of difficulty of animal that is being placed in foster homes, then I think that it could become more of a job than you know, just having an extra being in your house. for a short period of time. So I think that it's something that we should be thinking about, but I'm hesitant to jump to it right away. You know, I think about things like length of stay, and it drives me crazy to think that to hear people say that every animal should have the exact same length of stay. And no matter what they are, how old they are, what their medical problems are, what their behavior problems are, what they look like. And I think just like we need to be thinking about individual animals and trying to create metrics around what's acceptable for things like length of stay or money spent on them, we need to be also considering what kind of home is necessary and really trying to think outside the box. You know, if you can't, you know, thinking about these lists that we have of people that are signing up to foster right now, and probably a lot of shelters are in the same boat. You have tons of people wanting to help, and the vast majority of them are going to be homes that can accommodate a puppy or a couple puppies or a small breed dog or really easy cheesy large dog, cats. But the ones that we really need to hone in on and spend more time and more energy and maybe more money on are the ones that can help us with the animals that end up really in trouble in our shelters, either with ridiculous long length of stays at the shelter in a place that was never made for that, or animals that are so fragile they'll just die in the shelter. So like kittens that need to be bottle fed. You know, we have an opportunity right now with all of this incoming goodwill to really try to curate the list so that we can help solve for those animals too, and not just the easy ones.
Do you think that, so I've been thinking a lot about subsidized fostering because I do think there's a place for it, but I don't think what we subsidize is fostering. I think we subsidize a person who is going to commit to getting that pet a home and commit to doing certain things. So what we might pay for is great marketing of a hard pet that's living in your home.
Right, or leash training. Mm-hmm.
Or leash training, yes, or getting it some social skills or whatever it is. But I think we're going to be paying for the work that's done beyond simply housing a pet. And that's only for the hardest animals, because we found right now our shelter has, I think, 32 available dogs. Typically the number would be 450. We know when people are motivated, they're going to help us with the vast majority, but for that last 3 to 5%, we might be looking at paying for help. And so, okay, we have another question. So for those of us who are following NACA intake guidelines, how do we handle pushback from the community and other local shelters and rescues?
Is that around, I'm guessing that's around spay neuter or potentially lowered intake?
Probably the deferred intake is locally causing a lot of people pressure because they're expected to take in every animal no matter what.
Right. And
we talked a little about the spay neuter, but we haven't really talked about the deferring intake.
Yeah, and from my point of view, I think that part of this is it's kind of habitualizing this process. And so talking about it rationally with people is a good use of time up to a certain point. And then you just have to do the work to get the animals saved and to keep your community safe. And so I think that community members and even animal advocates are going to get used to the idea because we have no choice. And I think that it's unfair for community members to put the choice of euthanasia on a shelter director if there are alternatives that are out there. And there is an alternative. And I think what we need to do to help fight some of the pushback is to keep data. We need to know, we should be monitoring how many, are we getting an uptick in deceased animals found on the side of the road? Are we seeing that there's a lot of people that are overburdened and saying that they're dumping their animals? I don't know. And I don't even know if we have good baselines in most communities, but it seems like we really need to keep the data front and center. When you were talking about foster returns, that's another place. If you go from 1,000 animals in foster at a time to 3,000, you're going to have at least 3 times the number of foster returns. And you should expect that and prep your people for that, because it's going to feel like a lot, because it is. It's a lot. Numerically, it's a lot, but statistically and percentage-wise, it's the same.
Yeah, I mean, I'm thinking about cats and kittens, and kitten season's coming around, and last year we really embarked on this campaign to implore people to leave kittens alone. They were our most vulnerable group. We lost hundreds of kittens that we just couldn't, on some days we would have 80 or more kittens come into the shelter, and they were so little, they had been taken from their moms, and we were not able at the time to save them. And so this year we're doubling our efforts, and we're really going to push people to put kittens back. And it's going to be hard, but it was the right thing to do anyway. And this is giving us a definite reason. Before it was like a little bit hard because it was just business as usual, but now it really is life or death for them, beyond our ability to care for them well. And we're going to be pushing. Do you think what cats? I've been having this conversation with a lot of people. What cats need to come into the shelter? Like, if somebody is going to surrender an indoor cat that's lived its whole life indoors and it's friendly, there's a lot of folks who say it's better to take it into the shelter no matter what, even if you euthanize it, that it's truly inhumane to let that cat just let it outside. And I don't know the answer. I mean, it feels like a tricky one. What do you think about that?
I think it depends on the resources of your shelter. I think cats in particular are so adaptable and they are survivors. And so if you give the cat the choice, they're going to want to be put outside as opposed to euthanized. But I think that if you're in a very well-resourced shelter where it's easy to move them immediately to another home, that the kind of environment they're used to, that's great, do it. But if it means they're going to be stuck in the shelter and get sick and then get euthanized, then I don't think that's a good trade-off for letting them out.
Yeah, I mean, this is where the self-rehoming becomes really important. And this is another thing, like, as we're all working like 20 hours a day to totally redo the whole way we operate. And we've been putting together this resource list for how you rehome pets. And there's a lot of resources out there for self-rehoming. We haven't really even been pushing people to use them. There's Rehome. There are, like, locally, we have a whole list of self-rehoming. You could do an adoption application that the person can do themselves. Do you think it's possible that 50% of the people that surrender could actually be rehoming? Like, what do you think the percentage is? Do you think we have any idea?
No, we don't have any idea, but I think it's extremely possible. And I think that because our shelters are not open mostly the way they used to be, we're going to find out how easy it is. And I think you're exactly right that we haven't put the kind of resources we need to in that frontline support for people who are finding animals and people who are needing to surrender right now. And it's an opportunity. We have an opportunity right now to really think about how do we staff that up, either through volunteers or actual staff. One thing our team's been talking about today is we're not going to open our nursery because we can't have all the volunteers in there and all the staff in there. And so we need to push that out until this is all over. And we have a ton of volunteers that no longer have a job to do to come to the nursery. And so hopefully they'll foster, but also there seems to be some excitement about helping people that are worried about a litter of kittens that they found, maybe going out there and the recommendation that Cassandra, our bottle baby our Maddie's Life Saving Academy neonatal director talks about is putting a ring of flour around the nest of kittens. So you can determine if the mom comes back or not without having to hover and scare the mom away. I just love that. And so, we've got a way to make sure that it's safe, and we potentially have volunteers that are willing to go and make sure it's safe. It's just a completely new horizon. And these ideas are coming out of every corner of the shelter and our organization. And it's just so exciting to see, because this is what we should have had all along. Like, but we're all too busy. We're all too busy taking care of the animals in our shelters and trying to prevent death, that we don't have the bandwidth to really think about, okay, what else could we do? How could we do this better?
I know it's like every meeting I have for the next month and a half has been canceled if it's not related to COVID. And for the first time in years and years and years, I have time to think about these things. And we're all working at a mad pace. It's not to say we're not busy, but we're busy innovating. And I think we never have the time to do that. And it is true that somebody had asked earlier about volunteers. We need to think of all new roles for volunteers. That we shouldn't be just telling them, I mean, maybe in this immediate moment, they need to go home and stay home. But once that crisis passes, we need to think of new ways that they can engage, that they can help. And I mean, we envision people gathering in their neighborhoods and communities and creating networks of safety around pets where they live so they don't ever have to come to us.
Yeah, awesome.
It feels a little confusing, but it's the hope.
Right. No, I think that's exactly right. And, you know, thinking about, you were talking about changing up your staff, and we're thinking through the same thing. And we spent 2 hours today trying to walk through, trying to think, how do we help the fosters have a good experience, and make sure that we're doing everything we need to do, but in a different way than when they come to the shelter, when the animals come to the shelter. And I think that we're going to, as an industry, need to move a lot. We're going, for the first time in our history, we're going to have to make customer service number one. And that's just not how we operate. Animal shelters are really focused on the animal care and life-saving, and customer service is always a priority, but not the priority. And so we're going to have to up our game as far as what we're offering with communication and hand-holding and first impressions and all of, you know, we're not very good at that as an industry, and it's going to take a lot of work to change it around. But right now we have the bandwidth, and we potentially have the resources and staff that can't be used in the traditional way.
Are you going to be, I mean, you guys, APA has historically helped with disaster relief, and I don't know, in Harvey, you took like 40 bajillion animals. I don't even know how many. You guys saved the day. Are you going to be doing disaster relief efforts during this crisis, and what will that look like?
We are. So we are working on it's weird because we have everything's changing, and so the transfer ins are changing also. Our city shelter did an amazing job preparing for this crisis, and they do have a lot of their kennels emptied. They still have a line of fosters ready to help them. They've done an amazing job. And so we are looking at finding the communities that are having a lot of trouble getting animals out because of their county regulations or city regulations. They haven't been able to enact the NACA guidelines, and or they are completely shut down to the public after their shelter has been closed. And so those animals are trapped in there, and they may have animals that are you know, in danger of losing their lives, either from died in care or euthanasia. And so we're trying to be as proactive as we can and relieve some of that burden if possible. We have a limited, you know, we're not going to be able to take every animal in Texas, but I think that we want to make sure that animals aren't dying during this whole thing, if possible, whatever we can do.
That's amazing. And you guys have already started to help. I've seen a little bit on social media. I think that we're about out of time, but I want to touch on something that isn't quite as obvious, which is there's this fear I think we all quietly are having that a lot of people are going to get sick. I live in a community with a ton of older adults, a lot of assisted living facilities. And there's this fear that a lot of people are going to get sick, and they're either going to need temporary boarding for their pet or they're going to have to give them up. Do you think, so what we're doing in Pima is we're going to be working with one or more local boarding kennels to provide, we have a fund set aside for boarding because we have so many folks who they need to get a surgery and they don't have any, people are so disconnected, they don't know anyone to watch their pet. So we're going to be setting up, using that fund for people that really can't afford boarding. We're going to be subsidizing, or that's what we're talking about doing. So that we don't bring it on site, because I think it is problematic when we have empty boarding kennels all across the US. Why would all of those animals automatically come to our shelters? But I'm afraid if we don't move quickly, that's what's going to happen. It's going to be all of a sudden we're housing. What do you think we should be doing now to get ready for that eventual possibility?
Well, I think you're exactly right. You need to start reaching out to boarding facilities and get them lined up so there's a place for them to go. I think that, you know, there's a lot we don't know about this virus, and there was a call earlier today with some national folks about about what you do with an animal that's been exposed to a human that is very sick and then needs to come into a shelter. And so I think we're going to see the recommendations changing and kind of morphing all over the map. Some ideas that ran through my head as we were talking earlier is the maybe starting to enlist COVID survivors to potentially be COVID exposed fosters. If there's a need, we don't know that they can't get it twice, and so we need to keep that in front and center. That we don't know, but I think that maybe we need to be thinking about informed fosters that can help in a situation like that, and boarding facilities, anything we can do to keep them out of the shelter. 100% agree, because once they come into the shelter, it takes a lot of the focus off of what we need to do to keep animals moving quickly and prevent our cages from filling up.
Yeah. So we have a couple of questions. Someone's asked if there was research showing that animals find their way home faster if they're kept in their community versus in a shelter. And I believe there is research done on cats. Do you remember?
Yeah, for cats, it's a no-brainer. They're typically really close to their home when they are found. And my husband made a cameo.
Hi, Damon.
Anyway, dogs. Mark Sloat. I don't know if you guys know him, but he's at the Austin Animal Center, and they have data that shows that dogs are found within 0.24 miles of their home. And so if people could really focus on that statistic and kind of canvass the area within the 0.2 miles, that would be, super helpful, I think, because the home's probably right there, right under our nose.
The research in Austin is showing, I think he was saying that dogs are not going more than 1,000 feet from their homes. They're staying really close to home, and we're taking them so far away. Our county's 9,000 square miles. So pets, when they're brought to us, they're sometimes coming from hours away. And that's not, even 15 miles is a barrier. So if you can keep pets in your community, you're better off right now, but really always. So the last question, and Ellen, this one's definitely for you. To help with future crisis, what data is important to be collecting right now so it can help overall now and in the future?
I'm sorry, it cut out just a little bit. Let me,
What data do you need to be collecting right now as this is going on that can help now and in the future?
Well, I think that some of the points we talked about earlier would be worth collecting right now. So dead animal pickup, that's a horrible, morbid one, but understanding what the baseline is for your community. I don't know, like our government's kind of closed right now, so we couldn't even, we already have that data, but if we wanted to get a public information request out, we probably wouldn't get answered in a timely manner. But you can go backwards after this is over and get previous months, even previous years, numbers for how many dogs and cats are found on the side of the road dead, and then compare that to future months. I think that we need to be watching that closely, because if we're seeing that animals are suffering a worse fate because of the limited intake, then maybe we do need to tweak it a little bit. But so I think that's a really important one. I would also be tracking adopter returns and foster returns, because that's one that's going to get a lot of flack and a lot of scrutiny from the public and from your staff and from your volunteers and fosters, kind of this isn't working because look how many are being returned. So I would be looking at that. And I'm really interested to see if the length of stay from the time that their intake to adoption goes up or down in a foster home. I think my gut feeling is it's going to go up in a foster home because there's more hoops to jump through in meeting the animal, but maybe we're wrong. Maybe because the shelter system is set up in a specific way, there may be barriers in place for people to talk to somebody when they walk into the shelter, and so they may not be connecting with the animal right away like they would in a foster home. So I don't know, we're going to have a lot of really interesting statistic to look at, and I think it would be great. Maybe we can crowdsource some data points and keep those running on a monthly basis so that everybody can see kind of what's happening as trends over time.
Yeah, animal shelter research guru Gary Petronic has been doing the research on our foster program for the last couple of years, and he's really interested in looking at length of stay in shelter for pets that go to foster versus those that don't. He feels like the only life-threatening thing that happens is when they're in the shelter. When they're in foster, they're generally safe. And so he's really focused on looking at if we're going to house all these pets in foster, what would be their length of stay in the institution itself. And so we need to be looking at that too, because we can potentially, even if they're in foster longer, we're reducing their burden on the system, and we're reducing their vulnerability while for that time they're in the shelter. One last question, which is any recommendations on rescue transports going north? And I think this is something you and I both feel really strongly about.
Right, and I would recommend going and looking at the American Pets Alive shelter recommendations for dealing with the COVID virus. There's a protocol in there for transport and doing it as safely as possible and preventing risk to people. And Claire Callison wrote that, and she's done a ton of transport work over the years, even before coming to American Pets Alive. And she has been in close contact with some people at the USDA to get the recommendations that they have for their truckers going between state lines or going over state lines. That being said, I don't know what the future is going to hold as far as interstate travel. There may be restrictions placed on that, but right now I'm not aware of any that would prohibit a transport of animals going to another community in another state. And kind of circling back to where we started, I think it's really important that we try to keep the pipelines open of animal life-saving, because we're seeing a ton of I don't know if it's a barrier or shutdowns or what, but I'm really, really worried about the future of animal welfare in our country, because we're seeing so many shelters close their doors. And so the ones that are willing to stay open and keep trying to help, I think they need to, but they just need to do it in a way that doesn't risk people.
Yeah, this is not the time to give up. And I think sometimes it's like when shelters get overwhelmed, they do tend to just close the doors and circle the wagons, but that's the old pound mentality. It's the old way of doing things. You shut the doors, and inevitably what that means is animals start dying. If animal shelters are shutting down, it is more likely than not that animals are dying for no good reason. And so we need to figure out this balance between protecting human safety, but also really recognizing and validating that we are essential public services. Our communities can't survive without us at this point. And pets aren't just disposable garbage anymore. They're our family members, and for many people, they're the most important connection they have in the world. With that, we're going to close, and thank you all for joining us. If you are a paid or unpaid animal shelter professional and you want to join the American Pets Alive Rescue or Shelter and Rescue Support group on Facebook, we are having really big, robust meetings every Monday at 7 a.m. Pacific Standard Time. And the announcement and link to join those meetings is in the group. So we're going to continue to have these Wednesday night conversations. We have one coming up next week where we'll be talking more about COVID, but we just want to thank you for joining us, and thank you for taking the time to be here. And thanks for all the great questions tonight.
Totally agree. This is a hard time for all of us, so it's good to be able to come together. Thank you.
Have a good night, everyone. See you next week.